I'm going to tackle the M in the title of today's session. So we have eHealth, eHealth and mHealth. So I'm tackling the mobile aspect. Without promoting SAP, SAP has software in many areas of healthcare. But I'm taking one small piece today, and I won't take too much time because just to make sure everybody has a fair say. So I'm looking at the mobile side. It was mentioned in the Accenture presentation. It was maybe mentioned here about the last mile, or the last few feet to the bedside, as I like to call it, where the doctor needs to have the right information with him at the right time, which is when he's next to the bedside, next to the patient with the latest information. I also think that the patient is becoming a very demanding individual. I'm a patient and I'm quite demanding when I go into a hospital, and it's key, particularly for private hospitals, to think about that patient satisfaction, and I think mobility helps in giving that patient a lot of satisfaction because it helps give them knowledge about what's happening to them. And I also think mobility can help improve clinical outcomes. And we're all here today, I think, really for that one purpose. We talk about many aspects of it, but we're all here to improve the individual's health. So before I move to the next slide, are there any doctors in the room? Who's a doctor? Wow, that's fantastic. I go to so many conferences and I ask that question and there's one hand and 55 people from IT, so that's great. So I'm going to refer to doctors here. If I get it wrong, you can shoot me down, preferably afterwards, but I'm going to have a certain view myself, so forgive me if you disagree, you can challenge me afterwards. So we think the mobile revolution is here. Right? Another question is, who has a smartphone or an iPad or a device of any sort? I mean, I think most people, right, have a device. There's figures in America at the moment, and I know in India you can say, we're India, we're not like America, but in America 25% of all doctors have a device. And they predict that in the next 18 months, 75% will have a device. And the doctors are walking, at the weekend, they're out buying their device, walking into the hospital, and on the Monday morning saying, okay, Mr. IT, can you plug me in now? Because they want that information with them when they're next to the patient. I mean, we've seen, I'm sure we're all aware, the paper at the end of the bed. And we've also seen in the last presentation the computer on wheels, the cows. I don't know if there's any hospital or doctors that have tried that, where you literally put the computer on a trolley and you're pushing the trolley around with you as you go round the ward. I mean, it works, but you have the issue around the power and the curtains, and then I come again from Singapore, and you can always challenge that that's not India, but in Singapore, all the doctors desperately want an iPad. We presented our clinical solution, so we also have a clinical solution. So I had two guys for 3 weeks build the solution to demo to the hospitals, to the doctors in particular. It was Friday afternoon. We've done 5 days of demo. We've done HR, finance, we've done admin, we've done the nurses, and on Friday afternoon the doctors came in. And we showed them our system, our PC-based system, and you could see the wrinkles on their face. They're looking up saying, and one doctor said, he just stood up in the middle of the presentation, he just stood up and he said, I'm not using it. I don't care what you tell me, all I want is a result. And then we showed him the solution I'm going to show you in a minute, and he liked it. He completely changed. It changes the engagement with the doctor. I think we'll walk through and then maybe I'll make that comment at the end. But what challenges do you have with mobile? Well, there are many different devices. We all know that with the adverts in the paper. Therefore, there are many different operating systems that IT has to work with, and therefore many form factors. Plus, patient data security is key. I mean, we all know that. And what happens where now we're using a mobile device? How does IT control the security on a mobile device? And there are multiple sources. We saw in the last slide how many IT pieces of software may be in a hospital environment. I'm particularly referencing here. But there could be many, a lab, a PACS, a clinicals, ADT, registration. So it could be lots of different systems. And how do you make it successful? Well, you have to give the doctor the functions that they need. The doctor is the mobile warrior or the mobile worker within the hospital. You have to make it easy for them to use. The reason they're not going to stop and spend time at a PC, they don't have time, right? They're there to save lives, to move on to the next patient. And you see many times a note's written and left to the student or left to the nurse to type on the system later, right? Well, so you've got to make it very easy for the doctor to use. We've mentioned security, and then potentially the customization. What does this individual doctor, what other things do they want to do? So really you need a proven mobile architecture in order to get through all those challenges. So SAP has a mobility platform. It's the only IT slide, I promise you, in all the decks. So for all those people that didn't put their hands up, this is probably for you guys. So we have a mobility platform. Within that, it has all the deployment, the security. If you leave the device on the bus, you can switch the whole device off so that nobody else can use it again. It can link to any type of iPad or different device. And it can link to any software in the background, any PACS, radiology, clinical, EMR, registration, ERP, finance, any system in the background. It also links to SAP system, obviously, but it links to any system, not even, but a customized build. So many people have custom apps. We can link to your custom app. So if you've got a custom app that has been in your hospital now for 5 or 10 years, and maybe is looking a little dated and has multiple systems, as we heard before, you could use the iPad as a way to link all those systems into one view, and suddenly the doctor, through an easy user interface, is now very engaged with IT. I'm going to roll a video now, hopefully. I'm nodding so that the noise doesn't blast you.
The clinical working place of the future is mobile. SAP EMR makes it possible to access patient information reliably and in real time. It's important that the data is accessible in every part of the hospital. Charité is the biggest university hospital in Europe, but size is not the most important thing. It is also one of the leading university hospitals in Europe. Today, doctors are to a large extent also organizers and secretaries for patients, and that's something that distracts them considerably from the traditional profession of being a doctor. If you look at medical workplaces today, they are overcrowded areas where doctors and nurses have to type up all the data. Time spent on manually compiling data needs to be reduced in the future. At the same time, the data has to be instantly accessible. In order to gather experience, we are using SAP EMR in a pilot project so that patients' health records are accessible on the go. The aim of using mobile technology on ward rounds is that we can always find the most recent results for every patient and have access to these results, not just in one place, as is the case with paper files that can only be in one place, but at the same time in different places wherever they're needed. This means when an examination is done, It can easily be documented, and so everyone else on the ward can be briefed on its results. Searching for documents is no longer necessary. There is no need to create a to-do list manually and then later transcribe your notes in your office. They're transcribed when you make the decision. A particular strength is that during rounds this data can also be easily shared with patients. For example, you can look at x-rays together. Our vision is that over the course of the day, we can optimize our work during the morning meeting when discussing diagnoses, or even during rounds. That will make work easier for doctors and also shorten waiting times for patients. The good thing about this app is that it is easy to use, even if you have no previous IT experience. What we've experienced with this, and what was different in this extent to other IT projects, is the enthusiasm of the doctors and their joy at soon being able to use a new system. The advantage of SAP's overall concept is that everything runs on one platform, the Sybase platform. This makes it possible to extract information from the SAP infrastructure, make it available on a mobile device, and to be presented with the information for whichever situation I am in. We plan to provide every doctor with a tablet so that through SAP EMR, every doctor has their own personal digital version of patient files at their fingertips.
SAP helps charity run better.
So just to conclude, we've got a number of hospitals like that with stories like that where the doctors are very keen to share their use. So they're getting a single source of the truth from multiple applications in a device that they can walk around the world with, that they can have with the latest information as they work with the patient. The platform removes all the IT issues that we mentioned before, and hopefully what we feel is that it can deliver better clinical outcomes, so the doctor can have the right information at the right time to deliver the right diagnosis. I was going to demo, but we don't have time. It's on my iPad. If anybody wants to have a look, I'm happy to show them afterwards. So I don't think I've answered many questions, maybe just one or two, but I hope you found that interesting. Thank you.